is rotating, right? Then when you are rotating, actually the scales allow you to put the bags, right? So these are the bags, 5-liter bags, comes like this, right? You need to make it unsealed, dilute it. Later on, maybe after 1 year, right? We have a software which we'll install into the machine, and this is to start the blood pump. This is to stop the blood pump. The red one will stop the blood pump, and the green one will start the blood pump. And this is only for the blood pump, not for these pumps. Okay? And the mute button is specially there, right? So we'll start this. See the indicator status bar. This will give you 3 colors: red, green, and orange. Green means everything is going fine, smooth. Orange means machine wanted to give you some kind of information, right? And red means that machine is giving you some troubleshoot. There is something going wrong and you need to correct it, you need to check it. Uploaded, the software will upload. Then this is the pump, blood pump and dialysate pump, ultrafiltrate pump and the substitute pump. Apart from this, we were talking about the citrate pump and the calcium pump, right? So this is although a very small pump, but this is coupled with the blood pump. The citrate pump is coupled with the blood pump, and the calcium pump is coupled with the ultrafiltrate pump. So whenever, if you are increasing the blood pump, the citrate pump will also increase, right? Similarly, if you are increasing the ultrafiltration, the calcium pump will also increase, right? Then this is for the venous pressure monitoring, and this is for the arterial pressure monitoring. This is for the axis pressure monitoring, right? So, and this is for the ultrafiltration pressure. There are 3 pressure domes, and this will came out, right? Once it will came out, you will put all the consumables into it, all the tubings into it, and then it will go back, right? Here is a sensor. It will be throw some lights on the kit, and it will identify the color of the kit, because kits are different. Citrate kit is different, Sika kit, right? Trisodium citrate kit is different, and heparin kit is different. Okay, the therapy which you will hold the bubble catcher, and this is the air detector, as well as it will identify the blood, right? And this is the occlusion clamp. So this is venous occlusion clamp, and that is arterial occlusion clamp. Okay, the red one. And at last, this is our blood leak detector, right? So this will identify the leakage of blood. Once I started, this machine is asking me to do the functional test. Functional test will identify whether everything is good or not. If something is not working, then it will show you the alarm, right? Functional test will start. It will complete on 100% until I'll show you. The scale 1 is of green color, the scale 2 is of white color, right? It means whenever you are doing the therapy, since the solution and the concentration is same of the multiply, right? So how we consider which solution is substitute and which solution is dialysate? So it is divided with the color code. You will put the green one for the dialysate and the white one for the substitute. Similarly, this is scale 3 and scale 4. So this scale will identify whatever fluid you have been kept on the scale 1 and 2. After the rate you have decided, the CRRT dose you have decided, right? The same flow and the same collection of fluid should be on the ground, right? Because this machine doesn't work on the volumetric, it works on the gravitometric, right? There is the difference between hemodialysis and the CRRT machine. Hemodialysis machine works on the scale 1 malfunction, right? As you can see, and beside this there is the heparin pump, right? So we can connect the heparin. So we have almost 7 pumps: CVV HD, CVV H, CVV HDF, right? The dialyzer will be used by AV, right? The AV flux dialyzer will be used. This is a high flux dialyzer, no matter you wanted to do HD or HDF, right? Because all the ICU patients need to be removed, all the middle molecules with the diffusion, right? If we are supposed to put any low flux dialyzer, then we'll not get the clearance very fast. Dialyzer is special because number of pores, right? The number of pores where diffusion happens 100 times less into this dialyzer compared to that dialyzer. Use the therapy. What therapy we have? We have CVV HDF, right? Either we can do pre or post. Pre or post means pre I'll select if I don't want to give the heparin. Post I'll select when I wanted to give heparin. Sika CVV HDF and Sika CVV HD. And for heparin, it is available with pre and post both. Plasma exchange, right? We have options, especially we have designed it so that machine can well guide you that when you are doing therapeutic plasma exchange, how to do it, right? And then pediatric CVV HD also. Pediatric CVV HD is starting from 8 kg to 16 kg. Means you can take the patient from 8 to 16 kg. If you are taking 8 to 16, first option you need to press. If you are taking 16 to 40 kg, second option you need to press. Why? Reason is 8 to 16 kg, the dialyzer will be different. 16 to 40, the dialyzer will be different, which is 0.2 meter square. And 16 to 40, we have AV400, which is 0.7 meter square. Done. Kit will be same, pediatric kit. This is adult kit, but kit will remain same for the both pediatric patients. Now, to show you a full-fledged working of this machine, I'll select CVV HDF, because in CVV HDF you can see the full working condition of machine, right? And the best part is, I'll suggest you, whenever you are doing CRRT, always start with CVV HDF. The reason is, if I have started with CVV HD and second day doctor is saying that the patient is going into sepsis or the patient's interleukins are getting high, I wanted to remove cytokines, right? So you cannot switch from HD to HDF. You need to stop the therapy, you need to throw this all, you need to put again new kit, and then you will start with the HDF. So it is a cost, right? So what you can do, you can start with the HDF and during the therapy, you can switch. HDF only gives you this flexibility, otherwise you can't do. And how to do? When you selected HDF, right? I have selected HDF, so it means I have activated the substitute and dialysate both, right? If I would like to switch from HDF to HD, then I'll switch the substitute. It will be only diffusion. There will be no convection, right? And if I wanted to switch from HD to H, so I'll switch off the dialysate, I'll on the substitute, only convection will happen, no diffusion, right? So that's how you can switch. You can switch to scuff also, no issue, right? I have selected post HDF. Now it is asking me to fulfill the requirements. What are the requirements is the calcium containing solution, which is multivig, okay? This is why calcium containing, reason being because we are not using citrate. If we are using citrate, we'll not use the calcium containing this multivig, right? It will be used only into the dialysate, not into the substitute, right? I'll not go into calcium containing multivig so that it can have calcium, and 50 ml of syringe with a 1 filtrate bag. So we have filtrate bag. If you are keeping 20 bags on the upper scale, then you can keep 2 bags on the lower scale. And this is an empty bag. It will collect all the fluid which is coming from the upper side, right? So yes, as this machine is asking, I have all these things, so I'll go okay. And just I'll tell you one thing, follow the instruction of the machine, nothing else you wanted to do. Just follow the instruction, read these things and see the picture. You will be able to manage everything. Even any troubleshoot is coming, there is a question mark on the troubleshoot, just press it, you will identify why it is coming. Just resolve that, it will be resolved, right? Now it is asking me that you can put the dialyzer here and the cassette which comes with the tubings, right? You will hang it on the machine pole. So there is 2 pins. This is the holder pin, cassette holder. You can hang it because this is bunch of tubings, you cannot manage all that. So you can hang it and properly insert it, right? And hang the NaCl on the IV pole. So this is the IV pole and this is the citrate pole, Sika pole we say, not normal saline. Sometimes we think both are the hanging scale. Why not we can hang their normal saline? Reason is we'll prime with the blood pump, right? So if we are putting the blood pump here, then we need to connect it there, right? And there must be almost the dialysate and substitute tubing is also there. So you will get confused. Just make sure this should not touch the scale. The scale is very sensitive. If you are putting air or fan on AC on the scale, this will deviate and this will give you alarm. Even a single needle, if I put here, it will deviate. It will identify the weight, right? So this is very sensitive, you need to take care of it. This is a tubing cassette. Please excuse me with the hygiene. I have hanged the dialyzer, I have hanged the normal saline and hanged the cassette on it, right? Now the next step. Now it is saying put the venous chamber inside. I will not read these steps, okay? It will take time. You can read it first if you are doing first time. You please read it, okay? And whenever you are reading the first step, after reading it, please see into the machine where it is. Then you will have the idea where I have to do, okay? So put this venous chamber line and connect the full venous chamber connection, the only blue line, right? So I'll put the venous chamber and I go in one direction first and then the second direction, okay? Whenever you are putting this venous chamber, make sure it should be properly down, right? And that's how it should be up, 3 fingers. This is the correct positioning. That's why this bar has been given that it should not go more down, right? And then you will enter this air detection, the occlusion clamp. You will also get it into the kit only. You need not to worry about it. And just hang it, right? I'll close the clamp until I'm not putting everything on, okay? Now the first direction is done. I'll go with the second direction. This is the venous pressure detection with TP. You don't need not to put any extra TP. Just make sure it should be dry. If it is new, it will be dry. I am reusing it. It may be create any alarm, right? Then after this is the line, venous line, which is going into the dialyzer, right? Now I have to put this dialyzer upside down to prime it, right? That's how we do in dialysis. Yes, no, please. I think yes, no keeps you helping in awaking, right? As you can see from here, followed by this and followed by this, I have completed the circuit which is being given by the machine, right? Now I will proceed for the next step. Now it is saying the first step, you have to put this pump segment into this pump. Now there is the confusion. This is the pump segment and there is the notch of this pump. And this notch will go inside of the machine and machine will identify that you have inserted the pump and it will give you an audible signal. This audible signal, once it comes, make sure, means you are sure that it has been inserted and this pressure domes will come out, right? All these 4 pumps, whenever I insert, it will give you an audible sign. Just fix it properly, okay? It should not be in other directions, and then just push it. That's it, okay? See, the domes are coming out. Done. Now I'll follow the upper direction first. This one. This is the pressure dome, and there is some two surface, rough surface and the soft surface. Okay. This inner side is the soft surface, and this is the rough surface. Rough surface will always be on your side. Soft surface will always be on the machine side. And put it inside of it. And very carefully, right, because this tubing, if get kinked, it will not work. Yes. Now I'll connect this. Done this side. Second, again rough, soft. Done. Arterial occlusion clamp, and then this line will go into the normal saline with this spike. Now this spike comes with the kit. Make sure this spike, actually this is only one spike you will get into the kit. So make sure you don't lost it, because when you return the patient and if you have lost it, then you have to manage with the IV set, right? And this is very easy to return. You don't need a IV set and that much big IV set and roller, right? That things you don't need to do. So that air can go inside, right? And open this clamp. That's it. It is correct. Will go with the normal saline, right? And if it is like kept with the normal saline, somebody come and throw it. So I'll suggest you that once you have used the normal saline, please remove from the bottle and keep it with you. Okay? This is the yellow or the ultrafiltrating. Same process, again repeat. There is the dome, insert, then this same tubing will go into the blood leak detector, and there is the confusion happens, should I put this tubing into the blood leak or this, right? So always remember which tubing is going inside this dome will go inside the blood leak, okay? And this followed by, it will come into the dialyzer. So now I'll connect at the dialysate compartment segment for ultrafiltration. It means this will create negative pressure and remove fluid from the dialyzer. Yeah. Where the blood is entering, it means the dialysate will enter from here. So blood entry and dialysate entry both are countering to each other. So this is the idea behind it. How you can put with the red. See, this is coming. Now this has been left. Where it will connect it? It will be connected with the filtration pump. Okay, you have to just put it on the scales. And my another request to everyone, please do this therapy with some patients. Don't go like as you do in hemodialysis, right? Because if you don't keep patience, you will do mistakes, and that mistakes lead to trouble into the machine, and then you will not able to operate the machine. Asking me to put the solutions on the scale, right? Now I'll show you how to prepare the solution. So that's how it comes. You can see the separation, right? Can you see it? So what you need to do, you just push it from the bicarbonate side, right, to the lower portion like this. And this is the connecting port with this machine, with Fresenius machine. If you wanted to connect with some other machine like Baxter, this port can be used. Or some different machine like Gambro, this port can be used. So all the machines, all the CRRT machines can use this solution. It is not like it is compatible with the Fresenius one, right? So I'll put it on the machine. And also, once I'll connect, see there is an arrow inside of it. Can you see it? So we need to break this arrow. We'll do like this. Simple. 1, 2. That's it. It will be fixed. Right? Otherwise the fluid will not come. And simply from the front you can put it. Done. Now it is asking me to put the dialysate and substitute pump both. Same with the notch. Push it. Simple. Now, after putting this, I'll follow the first one, then I'll go with the second one. Okay? So, first one, see, this is the heater bag, right? What happens? You need to maintain the temperature of the patient, right? So, for that, you cannot heat up the blood. What we follow is, we follow to heat up the dialysate or the substitute, right? And that's how we maintain the body temperature of the patient. This is the best technology, right? There will be no hemorrhage, no RBC damage. So you need to just put this green one down, okay, and put it into the heater. And just hang it here. That's it. Okay. Now this line is the dialysate line. It will go where? Now the dialysate will deliver here and it will be removed from here, right? This is the roll portion of this, right? And this is going and connecting with this pump, right? It means whatever fluid I am using here, the same fluid is going there, right? The fluids are same, only the delivery is different, right? This dialysate is going into the dialyzer and this substitute is going into the here, venous bubble catch, right? So it will directly go into the patient blood. So that's why it is substitute. Similarly, this is also having the heater back. Okay, I'll connect it same. Okay, and now this line will go, this line, right? It is going into the venous chamber, and there is a port which has been given. So I'll connect on this port, and this is become post dilution, because venous chamber में blood कौन सा आता है? Dialyzed, right? So this is the post dilution. If I have connected here, it will be pre dilution. Okay. Now there is only one thing left on the other side of this. See, this is a Y connection. One is going here, one is going there, right? And then another Y connection here, and then another here. It means at a time 2 dialysate, 2 substitute. Okay. So I'll clamp everyone. Connection is very easy. As you connect with the lure lock connection is there. So we have done this step. Now next, it will be fitted with the parent pump. Don't use 30 or 20. Okay, this can be fitted with 50 and I take a bit of saline so that air will not enter. How you will do the dilution of the heparin? Simple, 25,000 of heparin, right? Dilute it with the 45 ml of normal saline, make it 50 ml. Each ml is 500 unit, right? Whatever dose you wanted to give, written by the physician, you will follow each ml. Because ml you will prescribe to machine, but the delivery will be into the unit, okay? And this is the line with the heparin. Simple. And this is one way, by the way. This is not both a way. You cannot suck. You can only push. Right? The domes are gone inside. Now you will not be able to remove it by your hand. Right? And this is not the machine that anytime you wanted to stop the therapy and just you just press the stop button and just remove all the kids. No, you can't. Machine will allow you. Right? So filling tubing system. The instruction is coming filling tubing system. I have to read what instruction has been given. It is saying open clamps. Which clamps? Those clamps which we will use. Those which are not in use will not open. This is already open. This is already open. Start. Now, until it is priming the kit, you can fill the treatment data. Now, what is the substitution? 900 and the dialysate 900, right? 100 is the ultrafiltration. So go with it. Ultrafiltration, you will start with this button. See, all are blank. Can you see the gray buttons? You don't have access to put any ultrafiltration, right? So what you will do, you will press the blue button. This will give you access. Okay. Now how much I wanted to keep? 100 ml, right? 100 ml. Substitute 900 ml. 900 ml. Okay. And dialysate again 900 ml. Done. Okay. Now, maximum substitute and maximum dialysate can be kept 4800, and the minimum dialysate and minimum substitute can be kept 600 ml, and this is in hours, not in minutes, right? If you convert it into the minute, it will be 10 ml per minute. 600 ml per hour means 10 ml per minute, right? And 4800 means 80 ml per minute, right? So then if you wanted to give heparin, just on the heparin and just mention what is the infusion dose you wanted to give. For example, you wanted to give 750 unit per hour. It will be 1.5. Okay. Now this is the bolus dose also. So once you started, if you wanted to give bolus, you can keep 3 ml bolus and you can give it. This is not green yet, so you can't do it yet, right? Which option is into the gray? That is not active. The option which is into the blue, that is active, and you can select it. It is very simple, right? So now the start button is in gray, you cannot select it. Once the therapy will start, then only you can select, okay? And if the patient is falling into hypo, you can give substitute bolus maximum 200 ml at a time, okay? And dialysate temperature we can keep 36.5. Now the machine is preparing, we'll go into the preparation. See, 2 minutes 34 seconds it will take to rinse, And there is one more option, a very small desktop. I'll just press it for some time and this will be like this. Now any option can't be selected. Now what you can do, you can actually clean the screen. Okay, disinfect the screen and then press it again. You will be back. Good. So why this is there? This has been not removed. Cross contamination. Right? This will create cross contamination. And do the ultrafiltration rinse. I'll do the ultrafiltration rinse. You cannot fool this machine. Do the change menu and you can change it like this. Once you are going into the change menu, whether it is syringe change or the bag change, right? Make sure you exit immediately. Reason being, until you are on the menu, the therapy is stopped. Okay? So once I exit, the therapy will continue. Similarly with the bag change. Bag change option for these two bags and this bag. No matter which bag you are changing, you have to go into the bag change. This will open like this only, the heparin only, right? And frequently change the bags and came out from the option. Otherwise, your therapy will be delayed. It will be, the dwell time will be more, right? And these options are getting on when the blood is coming into the circuit. So treatment interruption means by chance your patient is patient needs CPR, right? Or maybe the patient is going for some surgery. So small surgery, we can wait for 2 to 3 hours, right? We can wait. We can go into the treatment interruption, we can wait, no issue. But if it is a long 6, 7, 8 hours, then we can't. Okay? Then there is a care mode. Care mode is when you are putting the patient on bath. In the morning, when we are doing bath, patient is moving here, there, right? You are moving the patient. So access can be hampered, right? And also the blood flow, the continuous blood flow can be hampered. So care mode is actually reducing the flow. It is giving a flexibility of the arterial and venous pressure, right? So that you can easily do the care and after that you can increase the blood flow. And this care mode is for 10 minutes. After that it will alarm you. It will remind you that you have activated the care mode. Okay? So switch it off. Care mode doesn't mean that you have stopped the therapy. Therapy is still going on. It is just that you have slowed the therapy. Right? I have selected switch post dilution. I can anytime switch to pre-dilution. After switching here to pre-dilution, I just need to switch from here to here. That's it. And it will be pre-dilution. Okay? So anytime I can switch from pre to post. For example, I have started with heparin. Or maybe the doctor is not confident, you don't want to give anticoagulant, right? But after 6 hours he is confident and he is saying, now we can give anticoagulant. So earlier we have started with pre-dilution, now we can go with post-dilution. We can switch anytime, right? Now see the hookup test in progress means it is checking the integrity. Okay? Yes, there is error into the hookup test. Why this filter is there? Anytime any clot which is broken from this dialyzer, right, can go into the patient body. And that can put the patient in stroke. Right? So this filter will separate that clot and allow the blood into the patient. Because we don't know how long we can run this machine. So I'll not put the patient. I'll just show you that after putting the patient how this machine looks. Can you see the therapy is now green? CVV HDF therapy post, right? You can see it here. Now heparin is active, heparin is going, right? And you can see the treatment page with this balancing scales, right? Whenever it is green, it means the treatment is going on. If it is yellow, it means the treatment is stopped. And once I'll go into the menu and I'll go into the back change, see back change, this will turn up to yellow. Until I remain on this page, the treatment will be delayed. Okay, so I need to exit very quick, and then it will go with the test pass, and then it will turn on the therapy. In this graph, you can monitor the axis pressure, the return pressure, which is venous pressure, the pre-filtrate pressure, this one, okay, and filtrate pressure, and the membranes transmembrane pressure. All the pressures you can monitor here. And if it is a good technician or a good nursing staff, he should monitor this percentage also. Can you see here? 16%. There is the blood flow 100 ml. There is the blood flow 100 ml, right? And below this, there is the filtration fraction. This filtration fraction is always low, and it should be low 20%. If it is going beyond 20%, the dialyzer clotting chance is very high, right? For example, I am keeping the blood flow low. See, it turn up red, right? If I am keeping the blood flow high, it will be green. How I can manage to minimize this? I can manage to minimize by decreasing the ultrafiltration. As much as possible, if I decrease, this will decrease also. If I decrease the dialysate and substitute, this will decrease. If I increase the dialysate and substitute and the blood flow is same, it will increase, right? So it is very simple. Whatever convective volume you wanted to achieve, you have to give that much of blood volume also. Blood 250, 300, 350, 60, 380, it is 4%. How it is reducing, right? It is reducing. And when I decrease the blood pump speed, it will increase, right? So you need to monitor this filtration fraction, and it should always be green and less than 20%. Done? Now here's the treatment time, that how long you have started the treatment. There is only 2 minutes. Okay? And this is the balancing. Balancing means that how much ultrafiltration you did. Since you started the therapy, how much ultrafiltration you did. And there is one option, switch off balancing. Means anytime if your patient is going into hypo, you can directly switch off the ultrafiltration, right? You need not to go here, net ultrafiltration, and switch it off here. Okay? You can directly go and switch off. Now, as I mentioned, from CVV HDF, you can switch to CVV HD and CVV H. How? Substitute, if I am putting the substitute off, it will become CVV HD. See, the F is gone. If I wanted to put it CVV H, then I'll sub it on and switch off the dialysate. And now this is CVV H, D and F is gone. Right? So that's how we can switch. But if I would have selected CVV H or CVV HD, I would not be able to switch to another therapy. So I will request you always select CVV HDF, right? If you are not doing therapeutic plasma exchange, because that is not possible. Okay? History, you can have the data of when you started, how much delivery you have given, what is the ultrafiltration you did, right? And this will show you which date and which time you have started the therapy. Also, the time when you started the therapy till now, how much time it's been, and how much effective treatment you have been given. Both time it will give. So a smart doctor came into the ICU, he will go to the history and he'll see, okay, it's been almost 5 hours doing this CRRT, but the effective dialysis, effective CRRT is only 3 hours. Then what you are doing for 2 hours? It means there was some alarm, or maybe you forget, or maybe something happened due to that the treatment was stopped. In this, you can have the history of events also, that what alarm occurred. Maybe you are right. Some additional alarm is coming which you cannot control, right? And due to that, that delay is happening, right? So the doctor will go into the events and he'll see what time this alarm occurred and how long it is coming, right? And then he'll calculate and he'll say, okay, you're right. Okay, so you can prove it yourself. You have an option to prove yourself. Okay. System parameter, you can go into the pressure selection. The frontline axis pressure, you can manage what pressure you wanted to monitor. Since it is 4-5 pressure, it is very complex graph, right? So you can make it simple by switching off all that and just like I'm putting just TMP, and you can see the only TMP is coming, right? So it is up to you that how you wanted to monitor. If I wanted to monitor all that, or maybe 2 of them, then I'll put it 2 and this 2 is 2. After that, you have a short key. Short key of what? Short key to direct go into the care mode, right? Short key to direct interrupt the treatment, and short key to switch to the pre-dilution from post-dilution. For example, this is post-dilution. I am switching to pre-dilution. See, switch to pre-dilution. Now what I'll do? I'll just clamp, remove it, connect here, unclamp, and confirm. That's it. Done. It will appear here. See, pre-dilution. Whenever you do anything, whenever you do any action which can hamper the integrity of this circuit, right? Or you wanted to open the circuit, whether it is heparin line or anything, right? The treatment will stop. Make it in your mind. So do it very quickly. Don't be into the, because I have seen इधर बात कर रहे हैं इधर लगा रहे हैं अच्छा ऐसे हुआ. This is what happens, and you will take 5 minutes. And whenever you are doing this therapy with this machine, CRRT therapy with CRRT machine, please be 100% with this machine. And divert, and you will forget something, and that something will come on later with a big trouble which you cannot handle. So be 100% until you are not ready with the treatment. Allow you to go into the treatment and rotate the top. It will close all the options. That's what you are facing, right? If at all you are falling in this kind of situation, what you can just direct. Five hours.